Good morning, friends. Welcome back to my YouTube channel, Medical Classes by Dr. Srinidhi Kumar Acharya. Don't forget to subscribe my channel and also please give your valuable comments. So today we will see some of the important MCQs related to neonatology, which are very common in our day-to-day clinical practice. And we shall see some of the clinical importance of some of the important facts in neonatology. So one by one we will start. Yes, now this is the first question. Poor skin turgor in neonate and as well as in infants indicates dash. When there is poor skin turgor is very poor. So in neonates and as well as in infants, actually it indicates what? It indicates hypoglycemia, it indicates hypocalcemia, it indicates dehydration, and it indicates hypertonia. So any one of you, which is the answer?
Dehydration.
Okay, it indicates the dehydration. Okay. In case of dehydration, what are the classifications of dehydration?
उसमें सर सेंसोरियम और स्किन टर्गर और जैसे टीयर थर्स्ट ये सब पॉइंट्स देखते हैं. सम डिहाइड्रेशन, नोड और क्या था, नो डिहाइड्रेशन, सम डिहाइड्रेशन और सीवियर डिहाइड्रेशन, ऐसे कैटेगरी है.
Okay, some dehydration, moderate dehydration, and severe dehydration. That is one category.
नो डिहाइड्रेशन.
Okay. Now there is another type of dehydration which we have, that is isotonic, hypotonic, and hypertonic. Rather, in the sense isonatric, hyponatric, and hypernatric. Okay, in isotonic dehydration, if the serum sodium level, electrolyte serum sodium level, if it is less than 120 milliequivalents per liter, then it is called as hyponatric dehydration, where sodium level is below 120. If the sodium level is in between 120 to 140, so then we will call it as isonatric. If the sodium level is more than 140, then it is called as hypernatremic, isonatremic, and hyponatremic. Now in case of hyponatremia and isonatremia, you may get the poor skin turgor, whereas in case of hypernatremic dehydration, you will going to get the duffy skin. Okay, duffy skin, thick skin, जो है duffy skin बोलते हैं. So therefore, poor skin turgor may be suggestive of a isonatremic or a hyponatremic dehydration, not the hypernatremic dehydration. So do you know any of the conditions where you are treating a patient of dehydration and the sodium level increases more than the expected level, leading to hypernatremia? This is possible when you are giving more sodium as a replacement through the IV route. Okay, so normal saline, if it is given more than the excess, that means more than requirement, so then it may lead to hypernatremic dehydration. That is also very dangerous. You don't have any poor skin turgor, etc. Okay, skin is very tough and it is just like the duffy skin, and it is very difficult to identify, yes, there is some dehydration is there. ये डिहाइड्रेशन को वहाँ पे आइडेंटिफाई करना बहुत मुश्किल है. स्किन थोड़ा रफ, मतलब वेट हो जाता है और डफी स्किन बन जाता है. ठीक है, सो दैट इज द इम्पॉर्टेंट थिंग. सो अकॉर्डिंग टू यू द आंसर इज डिहाइड्रेशन. ओके, नाउ लेट अस सी द नेक्स्ट वन. इफ यू लुक इनटू दिस आंसर, poor skin turgor in the neonates indicates the dehydration, no doubt, and there will be reduced capillary filling time and refilling time in such conditions. Okay, so you can see in the pictures, see the skin elasticity is lost, that is skin turgor is increased. Okay, so rather skin turgor is not increased, poor skin turgor is there. You can see in these two pictures where it is very clear. So usually such a poor skin turgor is suggestive of shock. Okay, the child is impending towards a shock because we have dehydration, there is a water loss, fluid loss, and every condition that child may go into hypovolemic shock. So this is one of the question. Okay, now come to the second question. Come to the second question in the series. A newborn baby is presented with the conjunctival and retinal hemorrhage. Conjunctival and retinal hemorrhage. The most likely cause of this presentation is, this is a newborn baby. The most likely cause for this presentation is dash. Newborn with the bleeding defect, normal phenomena resolved by its own, which is normally seen in normal vaginal deliveries, newborn with the coagulation defect, and mother with coagulation defect. A newborn baby presented with the conjunctival and retinal hemorrhage, the most likely cause for this presentation is dash. Yes, anybody?
So normal phenomena resolved on scene after NSVD.
Any other answers? Any other answers? Okay, so let us see the answer now. See, this is actually, there are so many physiological conditions. Okay, so physiological conditions which occur in the baby, we should not be considered as a pathological condition. Okay, common physiological variations in the child, and this is one among them. Okay, when the baby is undergoing the normal vaginal delivery, because of the pressure when it is coming through a narrow vaginal tract, so there may be increased the pressure, and because of the increased pressure, some of the capillaries which is present in the conjunctival area may get ruptured and leading to this particular condition. So this is called a subconjunctival hemorrhage. Okay, so these pictures are suggestive of subconjunctival hemorrhage, and this is quite common in the newborn baby. Sometimes even the retinal hemorrhages may also take place, but to see that we have to go for fundoscopy and all. Okay, so this type of presentation is quite common in the newborn baby, and there is no need of any of the antibiotic drops and all those things, so that will go into resolve by itself. Okay, so this is another important condition. So okay, so this everybody knows.